rule of three ways to achieve a diabetes free life. First is fructose avoidance. And if you look at the common sources of top dietary sources of fructose, the most important determinant of fatty liver is not just carbohydrate but the fructose content in the sucrose and corn syrups. Hence, some of the food that needs to eliminate it from daily dietary habits include sweetened beverages, sodas, iced tea, sports drinks, mixed alcoholic drinks, processed juices, smoothies, coffees. These contains lots of fructose. Apart from that, if you look at cookies, cakes, desserts, so everything which is very sweet and you take it, it's a high time we should avoid those fructose containing diets in that. Reducing eating intake of refined carbohydrates. In general, you should avoid any kind of processed food because that the key here is to reduce or remove refined wheat products, limit use of processed corn products and white rice. Some people also recommend to use brown rice instead of white rice, but it also has contains some kind of fiber also is there in the brown rice. A diet which a physician can recommend to their patients in such a case can include low carbohydrate and high fat diet. The idea here is to promote the use of real foods, reserve the use of industrial processed food to those who need them due to their altered physiology. So intermittent fasting, this is one of the very much talked after topic that how intermittent fasting can help people overcome diabetes. So the reversal of type 2 diabetes depends on two factors. One is you need to stop the intake of glucose and you should also need to burn off the remaining sugar. So you need to have fine balance, the intake and the output. The intake of blood glucose, whatever the sugar you consume, and the output, how you burn it. And if you'll achieve some kind of a negative balance, then obviously you can manage diabetes. A low carbohydrate, healthy fat diet reduces the incoming glucose load but does not burn off the existing sugar content of the body. So that's the problem with LCHF. It may reduce the sugar intake but may not help you to burn the excess sugar which is there inside it. So follow-up recommendation in patients who have achieved diabetes remission. So those who have achieved diabetes remission, they need to continue it for a longer period of time and they need our continuous support to maximize the long-term avoidance of weight regain. So the big question is, can diabetes remission be achieved in clinical practice? The last trial demonstrated that a low-calorie liquid diet could successfully be implemented in primary care. However, patients in the trial encountered weight regain. A solution to the weight regain is to use anti-obesity medication. However, the issue of metformin also needs to be discussed here. Metformin is one of the very common drugs which we prescribe in our diabetic patients, even in pre-diabetes and even GDM, gestational diabetes mellitus, we prescribe metformin. And one of the beauty of metformin is that it also helps in weight loss. But if we are giving metformin for a longer period of time, then we should also be careful regarding supplementing vitamin B12 because it also causes vitamin B12 deficiencies. The question that arises whether we should consider diabetes to be in remission for patients who are taking metformin for weight loss maintenance. So this is the question which you need to discuss with your patients, that whether they are comfortable taking metformin or not for the weight loss. The first step for ensuring diabetes remission is its diagnosis based on clinical findings. Lifestyle and nutritional interventions are among the key players for achieving diabetes-free quality of life. Moreover, protein, fibers, and low glycemic index are key pillars when trying to achieve diabetes remission through nutrition. Intermittent fasting, along with fructose avoidance and reducing intake of refined carbohydrates, forms the key to the control of diabetes and even its reversal. Although diabetes remission is subjected to controversies, it's best to follow up such patients at regular intervals to avoid fatal outcomes. The basic key message here is that diabetes reversal and diabetes remissions is possible, but it's not possible in all the patients at all the time. We need to select the right group of patients who can achieve diabetes remission based on their clinical findings, based on their lab parameters, and in basics, low carbohydrate and good amount of protein with intermittent fastings can help to achieve some kind of diabetes remissions. Patients needs to go apart from nutrition. What's more important is their lifestyle, whether they are doing aerobic resistance exercises or not, because that also helps to maintain the weight, to prevent any weight regain. 5 to 10% weight loss would be optimum for all our diabetic patients. If they do some such weight loss, their diabetes control will be good, and they can also go into a diabetes remission. Thank you, everyone.